How rare is adamantinoma bone cancer? Imagine a type of bone cancer so uncommon that most doctors might never see a case in their entire careers. That's exactly what adamantinoma is. It is an extremely rare primary bone tumor, meaning it starts in the bone itself, not spreading from elsewhere in the body. When looking at all primary bone tumors, adamantinoma makes up less than 1% of cases. Some estimates suggest it occurs in about 0.1 to 0.5% of all bone tumors. To give a clearer picture, in Europe, the chance of developing this tumor during a lifetime is roughly 1 in 900,000 people. This rarity means that even large cancer centers might only see a handful of cases over many years. Adamantinoma most often affects the long bones of the lower leg, especially the shin bone or tibia. It can also appear in other bones like the fibula, upper arm bone, or forearm bones, and very rarely in the jaw, hands, feet, or spine. It tends to develop in young adults and adolescents, with most cases diagnosed between ages 25 and 35. However, there have been reports of cases in children as young as and adults over 86. Despite how rare it is, adamantinoma is classified as a low-grade malignant tumor. This means it tends to grow slowly and is less aggressive than other bone cancers. Still, it can spread, most often to the lungs. Because it grows slowly, symptoms like pain, swelling, or a lump may develop gradually, which sometimes delays diagnosis. Treatment usually involves surgery to remove the tumor completely. The outlook for patients with adamantinoma is generally good, especially if diagnosed early. Survival rates 5 and 10 years after treatment are often above 90%. However, because the tumor can come back or spread, long-term follow-up is very important. From the perspective of bone cancer, adamantinoma stands out because of how rare it is and its distinct clinical features. It tends to have a better prognosis than more aggressive bone cancers. Managing it requires specialized care from teams experienced in treating rare tumors. If someone notices symptoms like persistent bone pain or swelling, they should see a healthcare professional promptly. Early diagnosis and proper treatment are key to achieving the best outcomes. In summary, adamantinoma is one of the rarest primary bone cancers, affecting a tiny fraction of people with bone tumors. Its typical location in the tibia, occurrence in young adults, and generally favorable prognosis make it a unique diagnosis. Anyone experiencing symptoms related to bone tumors should seek medical advice for evaluation. Remember, every case is different, and personalized care from medical professionals is essential for the best possible outcome.